Amazing. So, welcome to our first webinar of 2024 with our new and improved team of clinicians. And today we're talking all about dementia, memory issues, and metabolic health with our new doctor, Dr. Alpa. So Alpa, if you just do your first slide for me. So just some housekeeping. Thank you for spending the next hour with us. Make sure that you mute your sound. You can stop your video if you want to, or keep your video running. Please type in any questions as you go along. You can either send them directly to myself or put it into the chat as the question comes up for you. If you want to keep it anonymous, just send it over to me directly. We'll answer the questions at the end of the presentations. Just so that people are aware, this is obviously an open forum. And if you go on to the next slide, Alpa. Yeah. This is not providing medical advice, and anything that you see in here that you wish to try and implement, please make sure that you are speaking to a practitioner before starting anything new. So who are we? We are a multidisciplinary functional medicine clinic. We're based in Leeds, and I think some of you know us and have worked around us. We now have a really big team, and some of our team members are here. And I'd love to just ask them to unmute themselves and just say a quick hello. We've got Dr. Kerr, who's one of our BSEM certified doctors and IFM trained doctors, who is focusing now on hormonal health.
Hi.
We have our business support lead, Avron, who is supporting all the background stuff that's happening in our practice.
Hello, everybody.
And we have Bobby, who may not be able to unmute, but let's see if he can. Oh, he's coming in through a different channel. Bobby, are you there? Do you want to just unmute and say hi?
Hello, everybody.
Bobby is our pharmacist and coach who's supporting our patients with complex medical needs. And I think that is it at the moment. But if any of our other team will come in. So we have a collaborative care approach to supporting our patients, and we'll talk a little bit more about that as we go along. So I'm going to now hand you over to Alpa, who's going to do our presentation for us. Thank you so much, Alpa.
Hello, good afternoon, everyone, and thank you so much for coming to hear us and find out more about metabolic health and Alzheimer's dementia. So I am Dr. Alpa Kumar. I'm proud to be a part of this collaborative care team with Dr. Indra, and I am a GP with about 15-20 years experience as a doctor, telling my age there now, but I am a lifestyle and functional medicine specialist, which means that we look at holistic care. We want to find out more about you, listen to you, find out your life story, and work from the root up. Now, why are these two things important and how are they linked? Let's find out. So what is dementia? We started to hear a lot about dementia these days. It's an umbrella term which is used for problems which are caused, by abnormal brain memory or thinking process, but it also encompasses other forms of dementia, which I'm not going to speak in detail about today, but it's like vascular dementia or frontotemporal dementia, for example. So we'll be talking mainly about Alzheimer's dementia today, because we believe as a team that we can look into factors which can reduce the chance of you having dementia in the future. And if you've got a family history, we will work with you to find out the risk factors, your individual risk factors, and work with you on them. So here we are. We want to talk about preventing it. We want to talk about reversing it. We don't want to talk about a pill for every ill. So what happens in dementia? I mean, we all been there. We are forgetful sometimes. I do that. Where are the keys? And, sometimes I think I need like an Apple tag on everything in my house to find out things. But, those things happen. We've had a bad day at work. We are stressed and, you had a bad night's sleep. It all has a knock-on effect and, we get forgetful. But how is dementia different? Because it impacts the brain, it makes those changes which are progressively worsening. And then at the end of the day, they're impacting your independence in your day-to-day life. So for example, it's impacting how you deal with your finances, it's impacting your ability to drive, it's impacting your ability to go do simple things like shopping. So it is basically slowly sapping the life you build around for years away from you. Hence, we want to talk more about dementia. So also, you'd be surprised to know, I was, when I read the Office of National Statistics report, to say that dementia in 2022 was the leading cause of death in the UK. So this is very surprising. When we think about leading causes of death, we think about cardiovascular diseases like blood pressure or stroke, vascular diseases or diabetes causing a knock-on effect. But dementia was the leading cause of death. So let's try and understand why that is, what's happening. And the average time we say between a person being diagnosed and dying is about 5 years. That seems like a short time. We sometimes see patients living for a long time with dementia. And what we want is that once you're diagnosed, if somebody's diagnosed or your loved one is, we want to make those years productive by halting the progression and working with you, because we know that these statistics under those people, our loved ones who are individuals who've had, there's somebody's mother, father, wife, husband, these statistics are telling us there's a stark reality of far-reaching effects of dementia everywhere in life. And I know the effect on the family surrounding the person with dementia is immense. The emotional toil, from where the silent stage is progressing to when we start seeing symptoms, which can take, the roots of dementia can take about, 15, 20 odd years where you start seeing those symptoms. But, the seeds have been sown, if I may say, in middle age. So, that's where we're going to work towards talking more about it and seeing how we can proactively do things which put the statistics in our favor. We don't want to be a part of that statistics in the Office of National Statistics. So there we go. Some background effects, some interesting things, when you read more about Alzheimer's dementia, we talk about, is it something new? We're hearing so much about it these days, but it's not. It's more than a century old. So interesting case of, well, surprise, surprise, Dr. Alzheimer, who diagnosed it in a patient. Actually, retrospectively, what that means is that this patient was brought by her husband to a hospital in Germany and said, she's not herself. There's something different. She can't remember things. She's behaving oddly. Some days she's withdrawn and some days she's angry. So as you see, I'm talking about what we see day to day in patients who present with dementia, their thought process, their feelings, their senses, their whole identity in this world is changing. So that's what, Mr. Detter, who was the patient's husband, he presented his wife there in the hospital, and they thought, oh, she's got some psychiatric problem, she was in her 50s, I think, and they thought, some kind of psychiatric problem, we need to treat it. And then sadly, all those antipsychotic psychiatric medication didn't work. And when she passed away, the brain showed the classic, what we call as the plaques and, the twisted protein fibers. So medical terms, but I'll try and explain these to you. So what's basically happening? We rely on electricity these days, right? So there's an electric substation, then there's pylon, then there's cables coming to your house. So let's imagine, we've got all these cables, everything working, but then, BT has come around, or Virgin Media, they dug up the pavement and there's whole tangles of wire, and you've got no electricity in your house. Why? This is what the plaques are. This is what the twisted protein fibers are. You've got all the, your heart is working, your other functions are going, but something's happened in your brain. And now scientists are trying to understand, why are these plaques formed? Why are these protein fibers twisted? What is causing all that digging, causing, the failure of, so to say, the communication in the brain, where the person is losing their own self and becoming a shadow of their former self. So that was a brief kind of understanding of, the terms we hear day to day, amyloid plaque, the tau proteins and the like. So now, why do we talk about the brain? Brain, main organ in the body that works harder than anything else. Why we need to talk more and more about it is because, we associate, as I started off by saying, that we associate Alzheimer's with memory problems, thinking problems, not able to solve. You must have heard people saying you need to do puzzles more, you need to learn music. So why are we talking about that? Because the part of the brain, the cerebrum, so we've got three parts: the cerebrum, cerebellum, and the brain stem. So cerebrum is the one we're thinking about the memory problems, the problem solving things, lateral thinking, those kind of things. So cerebellum is the one that helps with the coordination and balance. What that basically means is that, when you get up, you've got some coordination going in your body, that I'm not leaning to the left or the right. Obviously, there are problems that happens, some problems can cause difference in coordination and balance. And the third part is the brainstem, which is all automatic. So if you compare, we need a car with a gear stick to think and join those connections, and there's an automatic thing that you just press the pedal, it goes. So similarly with the brainstem, don't need to think, I need to breathe now, or I need to stop my heart beating now. So those are the automatic things. So what gets affected in Alzheimer's? We very well know the memory thinking process, it gets affected, especially the short-term memory to start with, which is the area hippocampus here in the brain. But also progressively, Alzheimer's is a progressive disease, it's a progressive condition. So everything slowly gets affected. So if we go back to when we were talking about the Office of National Statistics, saying that Alzheimer's is a cause of the number one cause of death in the UK. Why is that? Because Alzheimer's is slowly taking hold over all parts of the brain. Say, for example, a person might not be able to swallow properly. They get what we call as aspiration pneumonia, there's food and liquid going in the lungs, so that's causing the death. So hence we say that Alzheimer's is the number one cause. The knock-on effect on the independence, on the ability to do day-to-day tasks is dramatically reduced. Now we talked briefly about brain health, Alzheimer's, what it is. So today we're sitting here trying to understand the link between the brain health and metabolic health. So what is metabolic health? So it is basically how good your body is in absorbing all the nutrients. So whatever you put in your mouth, be it carbohydrates, proteins, fat. So it has got the ability to absorb that and use it effectively without causing an unhealthy spikes in your blood sugar or abnormalities in your cholesterol or inflammation. So in other words, what I'd say is metabolically healthy means that you're able to respond to what you put in your mouth in a way that reduces the risk of your conditions like diabetes, say, for example, or heart disease or stroke, or other things like non-alcoholic fatty liver disease. So we have we as clinicians, when we're sitting in a general practice, say, for example, we love to label things, don't we? Metabolic syndrome, we love to give out pills for every ill. But no, as collaborative care, holistic functional medicine practice, we don't do that. We try to understand more about you. We want to know what is causing that problem in your metabolic health. Say, for example, there's a label of metabolic syndrome, which I think is very, useful in getting to know you better, because we're checking your waist circumference, and then, we finding out your blood pressure, your sugar, your cholesterol. And if you got 3 out of those 4 risk factors, you say you got metabolic syndrome. But how does it help us? How does it help us with that connection of your poor metabolic health to Alzheimer's disease? Now, let's see what the risk interconnected factors for Alzheimer's are. Right, so we've got inflammation, oxidation, insulin resistant, and cholesterol dysregulation. Now, big terms, I'm going to break them down for you, right? So we know inflammation, we've heard of that term before, but what is it actually? So you walking on the pavement, you have a fall, there's blood oozing, and then in a few days' time, there's scab forming there. So this is acute inflammation. That is good for you, because what would happen otherwise if all those cells don't come to rescue you and make a scab around there? You're going to bleed. That is our body's innate or internal mechanism. That's good for you. That's good for healing. We need that. But what is chronic inflammation? That is when all that mechanism goes on for so long. It is associated with pre-diabetes or autoimmune or other conditions like chronic fatigue syndrome. Autoimmune especially, we see a lot of chronic inflammation when we see patients in our clinic. Is there is a root cause there. The gut microbiome is unhealthy, where there's inflammation in the body. We see the inflammation markers are up. What is that? Your body's calling for help, saying, I don't want to be in that state forever. Fine, we see dust in our room or some dust on the carpet, we get our hoovers out, clean up, good. Right, what happens over time with the brain cells? So we've got these cells in our brain called microglia. They are the hoover cells of the brain. So when the brain is using up energy in glucose, there's some byproducts which we don't need in there. So these microglia come in and hoover it all up. Good, well done. But over time, if there's too much of that, too much of waste product, what's going to happen? They either going to get fed up, I've had enough, I don't know about you, but my cleaner would say, okay, fine, this is just too much work, too much. I can only do 3 hours of it, just create less work for me, right? Or it would be like your Hoover, your vacuum cleaner breaks down, right? So either of those. So either the microglia, they are, causing damage to your nerve cells, which we see is one of the classic things we see in Alzheimer's, or, they give up. They said, okay, just sort it out yourself. You're just creating too much damage in the brain. So when this is happening, we often see that this is taking hold in midlife, or even sooner, where our lifestyle choices, what we're eating, what we're putting in our mouth is affecting our brain. That's an interesting thought, isn't it? So inflammation is the first thing. And the second is oxidation. Now, to explain oxidation, I think the easiest thing I can tell you is that, you cut an apple, it's gone brown, and that is oxidation. That is what's happening. That's the oxygen that in minutes it will go brown. You leave it out, and if I don't know about you, but in my family, like, it's a brown apple, I don't want to eat it. Well, it's so this is what's happening in your body with this oxidation. So it is a byproduct of the chemical process going on in your body. So what we need that, because we need oxidation to digest things, but what happens as a side effect, as a byproduct, is what we produce, what we call as free radicals in there. But too many of them, I don't know how many of you've got teenagers, but I compare these free radicals to teenagers who are unstable, highly reactive. It's it's just one of those things. They'll be anything you say, it's very touchy-feely. So similarly, this free radicals in there, they've got a mind of their own. They just go on causing damage everywhere they see. Okay, and what makes it worse? If aging, inevitable, not in our, nobody's invented reverse aging yet, but that's the all age, and there's more oxidation, the more free radicals, and other variables, like if you are sedentary most of the time, or if you're not exercising enough, or if you're stressed, the free radical formation is high, because there's a kind of a chemical cascade going on in your body, which is causing that. So that was the second point. The third one, key, insulin resistance. So now I hope you're making those connections. The pattern I want you to look into and reflect on, today when we talk about it, and as you sit back and think about what I've spoken and what I'll be speaking in the next few slides as well, as to what is inflammation, what is insulin resistance, what's going on with the oxidation, because these are key things which connect the brain health with your metabolic health. So when we're talking about improving brain health, we're talking about starting from the grassroots. We're talking about the soil. We're talking about, what we need to nurture the tree of our life. So because if you're not paying attention to the bottom, the soil of our life, there is no point. I've never seen anything blossoming, if it's not been nurtured. No plants in my garden would nurture. They're not, it would blossom if they're not nurtured. So these 4 things that I'm talking about with brain health are actually connected to metabolic health. I'll come back to that in a minute again, because insulin resistance is talked about a lot these days. So what is it? So basically, glucose can only be taken inside the cells with the help of a chemical or a hormone called insulin, right? Which is secreted by the pancreas in the body. Now, if there's too much glucose in the body, it may be because you've got poor food choices, or you're eating too much processed food, or you've got a genetic condition like type 1 diabetes, which can cause that. So the blood sugar is rising in your body, but then think of it as a lock and key mechanism, let's say. So there is this receptor in the cell, and there's the insulin, which is the key, which is going to go into it, and there's so much blood glucose inside the cell, and insulin is saying, let me in, and the cell says, sorry, I can't be insulin. You're just destroying my receptor around there. I do not want any more glucose. So the cells stop responding. They're like, I don't need you here. So I've got enough going on there. So that can cause insulin resistance. That is what we call as insulin resistance. So the cells are becoming desensitized to the insulin. There's some damage to the receptor in that area. So what is happening as a result? So the brain, which needs glucose, we discussed, it utilizes 25% of the oxygen. It's the organ that needs the most energy in your body to function. It's being deprived of that glucose because we've got to a point where all these receptors are damaged, which we need to get the insulin in to process it. And, there's all this high blood sugar ravaging around in the body, and, it's damaging organs, it's the kidney, the eyes, and it's causing inflammation. So it's like a knock-on effect on everything in the body because of the desensitization to insulin. So the interesting fact is that hippocampus, if you remember, I was talking about it a few minutes ago, which is the area when the, in the clinics we do a scan, we find that's the area which is responsible for short-term memory. Hence, we find that patients with Alzheimer's, they would remember what they did in their childhood, but ask them what they had for breakfast, they'd have no memory of it whatsoever. So that area, hippocampus, in studies has been found to be shrunken in diabetes as well. So here's the correlation that diabetes, high sugar, hippocampus, shrinkage of that area. So people with diabetes often start having memory problems for that same reason too. Right, so the 4th cause we move on to is cholesterol. This is interesting because that is the gene we talk about. That's what people, the most common myth I hear about when I speak to, patients with Alzheimer's dementia or their families, is that they think, I've got the gene, I'm doomed. What do I do? There is a reason to be concerned about it, because ApoE, that's the gene we're talking about, that is the one that is actually responsible for carrying the cholesterol in the brain. So hence, we understand the link between the cholesterol and ApoE. So what are lipids? They're basically fat-like substances that line the cell wall, and we want them to be at a level where our body is not storing it in the liver, damaging the liver, or it's not storing it in the arteries. So many of us have heard about, cardiovascular bypass, where the arteries are clogged up with all this liver. So, all these atherosclerotic plaques, what we call them, and then the person needs surgery to clear them up, or an angioplasty and things like that. So similarly, the brain is getting all those plaques. If you go back to, what I was talking in the first slide, this is what is happening in the brain. That's another theory of how the cells are being damaged, because the blood supply, it's been limited because the metabolism of lipids is damaged. So vascular disease is a major risk factor. So when we say vascular disease, we're talking mainly about high blood pressure, stroke and the like. So what is the harmful part of the cholesterol that we're talking about? Because at the end of the day, we need certain amount of cholesterol in a body to form hormones in our body, because the hormones need cholesterol to be formed. So if we try and eliminate it totally, we are actually not doing a good thing to our body. We need that balance, and as functional medicine specialists, we talk about that balance, creating that harmony in your life. So hence we get into the nitty-gritty of things, to the base of things, to work our way up and see why are we not talking more about this? Why are we not talking about how we can take the responsibility of our health, and not just worry that we've got that gene and that's the end of it, because it's not. We need to equate our heart health, our general holistic health, to our brain health. So moving on to just a bit of statistics around there. So that ApoE4 is the gene we talk about, which is the one that's related to the risk of dementia. So if you haven't got anything, because as we talk about aging, normally, our brain's not designed to be the same forever. There is some kind of neuron, nerve cell damage, and there is a 50% chance that there will be slight dementia, but then it is in our hands. Do we want to be a part of those statistics? Statistics are variable. They change all the time. There might be a study coming out tomorrow which changes that statistics. And how can we do that? By taking ownership of our health, by being collaborative in our care, and working to find a personalized solution that works for you. Because, come to think of it, everyone knows we need to eat healthy. Everyone knows we need to exercise, but what are your personal risk factors? Have you got the genes? Have you got something in what we might find in the blood, for example, the oxidized LDL, which is the bad cholesterol level high? Because that is what we're looking at as holistic practitioners, is to find out whether we want to be a part of that statistic, the chance, because 2 copies of that, you start thinking at 65 years of age, I've got 1 copy of the gene from my dad, 1 from my mum. Now at 65, I've got 50% chance, and you can either dwell in that or change the statistics in your favor. That's what we're here for, right? So the epigenetics is basically a term. It's a heavy term, but we use that to say that we can change. Genes are not your destiny. Genes are not your destiny. Yes, I said it. You can change how they function. We can, some of the genes we can up switch, down switch. Yes, we can, by looking into what is actually driving that gene into switching on. Say, for example, I compare it to when we talk about autoimmune disease, not everyone with a family history of autoimmune would develop that. Why is that? Because there are certain individual factors in your life, be immense chronic stress or a life-changing event like a bereavement or a divorce, which has switched on that gene for you. So you, as an individual, your siblings might never have any symptoms, and that's what you've got in your inheritance, sadly. That's how it is. But how we work around those epigenetics, it's quite interesting. So the 2 things I came across, the first was rural India. So I'm always interested about that. In my gap year, I went to rural India and worked there as an intern, and I was absolutely dumbfounded, just in awe mainly of how simple their lives were, but yet how happy they were. We look at the Western world and we think, oh well, always grass on the green, always greener on the other side, isn't everything? They got everything, they've got this technology, but those were the happiest people I've seen. Why? And then now we see these statistics. They've got those connections. They eat a healthy, plant-based diet, and they're laughing all the time, laughter therapy, and they even if they've got the genes, it's not expressing itself, or they're not getting Alzheimer's as soon as other people in similar situations in the Western world would. So they've got, traditional diet, traditional connections, nothing called stress. They've never heard of stress. So there we go. And the Nigerian paradox was equally interesting as well. So there's a community in Nigeria which has incidentally got the highest rate of the ApoE4 gene, the one we talked about, which is linked with Alzheimer's in the world. But surprise, surprise, they've got the lowest rate of Alzheimer's dementia. How is that possible? So that is the epigenetics, because they've got a diet which is, very low in processed food. They've got those connections. We talked about rural India. So, are we seeing some similarities there? Are we working on, the genetics being trumped by the epigenetics? Food for thought there, isn't it? Some studies I want to talk to you about today, because Alzheimer's, we're finding newer things and newer studies associating it with various things. So we spoke about metabolic and Alzheimer's in a way that how insulin resistance, inflammation, your bad cholesterol, they're all, combining together and cause a cascade of changes, which takes its root from in midlife. So when we talk about diabetes, pre-diabetes, polycystic ovaries, and the like, which are metabolic conditions associated with insulin resistance, we should always be aware that we are actually at future risk of Alzheimer's. So this is a thing that we should carry and take away from here, that once we are dealing with our risk for pre-diabetes, diabetes, heart disease, high blood pressure, cholesterol, we are actually doing our brain good. Right. So now moving on to the other risk factors for Alzheimer's disease. So scientists have found that there is a bacteria, a bug called P. gingivalis, which is usually found in the gums. So it has traveled from the mouth to the brain because of poor oral health and gum disease, and they found it on autopsy of people with Alzheimer's that is there. So what is that bacteria doing there? So this bacteria, it actually basically destroys nerve cells, it destroys their lining and releases some enzymes there in the brain, which, eventually are causing that damage to the nerves, causing those tangles I was talking about, there's all those plaques, there's tau proteins, and this little bug from the gums, from the oral, environment is going up there and causing all that havoc there. And similarly, they've also found that mercury vapors can also cause similar effects. So environmental toxins, when we talk about, it's not just affecting, what we can see. If you touch, say for example, you're allergic to nickel and you're wearing a nickel earring, you would see that you got a rash, you got a redness there around there, a bit of pain. But what is it doing inside your body? All these heavy metals, or the mercury amalgams, or the bacteria, what are they doing inside the body? They are eventually, going in, causing a multi-system damage and causing, the big motor of your body, the brain, to have damage to the nerve cells. Now, moving on to, I always find it very interesting. There are a lot of theories, and I'll try to explain a few of them to you, about women, autoimmune disease, women and dementia. Somehow we seem to be the lot who's getting it more. Why is that? Now, and how can HRT help? So what happens is that, it's in perimenopause and menopause, around that time, the estrogen begins to dwindle. That's the hormone in our body that not only regulates our glucose intake, it is responsible for our body temperature and organizing our memory. So this is something, a super happy event in your life, a child is born, that's there in your memory. Then there's, or an event like a family wedding. So it's organizing all into, so if you own one of those Apple phones, or they bring in all those memories, categorize them on this day. So this is what is happening in the brain. The estrogen is helping us for that. So what is happening in perimenopause and menopause is that this estrogen level is dwindling. It's going down. So I spoke about body temperature and estrogen. So this is the main reason, hot flushes, we talk about it a lot. This is why that is, because estrogen is responsible for, regulation of the body temperature. And why do we have all those, the belly fat or, the glucose, you're craving for all those fatty foods? Why? Again, the estrogen regulates glucose intake. And then why do we have what we call as brain fog in perimenopause and menopause? Because estrogen is responsible for organization of memory. So there we see, women in their 50s would be experiencing those symptoms with lower estrogen, which again could be similar to what, people later in life experience with dementia, the memory thing, the body temperature regulation and the sort. So in a study done a couple of years ago, they found that, the HRT, both the older forms and the newer forms, they reduce the risk of disease like dementia. Having said that, there's also a new study that's come out last year, which has been, there's been no kind of link for it to show. But in my personal experience, I think when I see my patients and in our practice, when we collaborate together, we know that, those hormones are key. Obviously, depending on your personal circumstances and individual risk factors, they are so key in making you feel better, in getting the glucose response better, and getting the body temperature regulated. And, at the end of the day, the estrogen link and the dementia link is still new. It's in its initial stages, but we know that, estrogen, what it is responsible for and how we're linking it to your metabolic health there. So and the other thing I was talking about again, was autoimmune disease as well. It's more common in women. So autoimmune, as we know, has got issues associated with poor gut health, SIBO, or poor gut microbiome, those kind of things, and inflammation, which is the underlying current going around in autoimmune disease. So those kind of things, inflammation we saw is a common kind of factor for metabolic and Alzheimer's disease, and we're seeing inflammation in autoimmune. So all these things somehow coming together and linked together. So hence we see that women have got more incidence of dementia, sadly. So there we go. There are other factors in Alzheimer's as well. I spoke briefly about the environmental toxins. Vitamin D is a key player. Interestingly, if you think of it like, that the brain, the dry weight of the brain, 60% is fat, and it's omega-3 and omega-6 balance, and you also need vitamin D. There's studies that have shown that, levels of vitamin D lower in people meant that 60% of people in the UK have low levels of vitamin D, and it meant that they had more incidence of having dementia. So this is the power we're talking. We want you to take in your hands, where you know what your vitamin D levels are. And, we're talking about optimal levels. We're not talking about the basic level to get to your 35. That's not what we're talking about, because the study I'm talking about for vitamin D showed people with just levels of 50, they were at increased incidence. So we're talking about optimizing your health for you. So at the end of the day, we're reducing the chance of you developing future dementia, because we're taking control of the factors, what we can, and taking it from there. Similarly with omega-3 and omega-6. Now, omega-3, if you see, it's the fatty acid in the brain, and that's the main one, and there's omega-6 as well. So in our functional medicine practice, we, when we personalize nutrition for you, when we are looking into your individual nutrition factors, we look into the levels of those, because we know how important omega-3 is for, your brain health. So because it is involved in something called when we see levels of homocysteine that rise, which is a chemical, I won't talk too much about it because that's a topic for another day. We're seeing more and more of it being implicated in various factors. But in a sense, basic nutrients like vitamin D and omega-3 are also implicated in dementia. But a word of warning and caution there, I wouldn't think about self-medicating, because our bodies have to be in balance. You have to have a professional look into what's optimum for you. That's where we come to help you. Right. So, as you know, you've heard me a few times today talking about the tree, the root. This is how we work. We work our way up. You know, we nourish the roots of the tree of your life. And lifestyle medicine stands on 6 of those pillars. You know, we spoke about nutrition, exercise, sleep. The 4th is the addiction management, the connection, which I emphasize more when I was talking to you about Hawaii incidents in rural India. Was the lowest in the entire world. And then the stress management. Stress, I think, is a bane in the modern society. We really need to look into ways to control that. So I'll speak briefly about these things. Yeah, right. So, okay. So what we need to do, well, this is a bit of an ironic slide, hence I put the upside down yoga pose. I don't know what it's called. I can't remember the top of my head. But yeah, it's basically we have to do is to reduce what? When we're talking about brain, it's to reduce the damage, right? So, and the second thing is to increase our resilience. So when we reduce the damage, and in conjunction with increasing our body's resilience, we are paving the path for a better brain health for our future. Now, I don't know, it's somehow been the wettest February here in the UK on record somehow. Right, driving these days is a bit of a nightmare because everywhere there are potholes. You know, sometimes I'm trying to think, is it like half the size of an Olympic pool or what? So what do we do when we're driving, say, for example? But, you know, we try to avoid those. So that is the reduction damage. We don't want to damage our car. We don't want to splash water on the poor pedestrians walking past. What else do we need to do is to increase our resilience. What do we need to do? Well, in potholes, you probably write to the council and they'll write a pathetic reply back or something like that. But, you know, or an interesting fact I wanted to tell you, do you know that the maximum number of potholes per mile in the UK are in our ex-Prime Minister's borough, the borough of Islington, right? So, I mean, I don't live there, thankfully, but apparently there are like 26 potholes per mile. So, you know, you'd be like in a maze all day. But yeah, so just to give you context, so we need to reduce the damage to our brain, and we need to increase our resilience. How do we do that? Now, reducing damage is in your hands. How? We know high blood pressure, we know high blood sugar, we know high cholesterol, the high bad cholesterol. You have to take control of that. You have to reduce that damage. You don't have to drive your car over those potholes. When you are aware that there is a problem there, you sort it out, you swear away from it. And how do you increase your brain resilience? By, you know, exercising. That is how you're improving the chemical called BDNF, which is one of the, you know, chemicals that helps the nerve cells to grow. You're improving that exercise. You're making connections. You're meeting up with your friend for coffee. You know, in this day and age, we've all become too focused in our lives. It almost seems robotic. And, you know, so we need to build those connections back. You need to work on your resilience. So, and I think, in my opinion, in my own personal life as well, nothing works if I think, okay, I'll wake up on the 1st of January, I'm going to drink 2 liters of water, I'm going to sleep 8 hours per night, I'm going to meet up my friend for coffee, and here's my plate full of all those nutritious food. So one step at a time, that's where we're going to hold hands with you. We're working out a plan for you, which works for you, which steers you away from the potholes in your life, which, you know, the council here is much more effective. It'll cover those potholes, build your resilience, and help you achieve, you know, a better future. Right. So next we move on to the nutrition bit. You know, there's a whole lot. I'm sure our nutritionist Korishi could talk to you about an hour about nutrition and brain health. But I'll give you a brief. I have already about the omega-3 and vitamin D, but you need to look after your, you know, gut microbiome. Why? I'll quote you a recent study about you know, greens in the diet. And I think we kind of make foods good, bad, superfood. All we need to do is to fill up our plates with fruit and vegetables. So 1 cup of green vegetables a day in a study showed that, you know, you can be younger in your brain by 11 years. So, you know, that is incredible. So how do you achieve that? I'd say, I mean, in my household, we do like challenges. We have got a 30 plant point. So whoever gets to it first, you know, you every day, different color spectrum. So there are ways to go about it. You know, you engage as a family and get competing. It always works, right? And then there are also brain health supplements which have some proof of working for you. Again, I wouldn't advise, because as Bobby, our pharmacist, would tell you, they all react to it, especially if you're on medicines that have been prescribed by a doctor, for example, blood pressure or cholesterol medication. So what we're talking here about are lion's mane mushroom, advertised as brilliant for the brain, or ashwagandha. Yes, studies have shown that they would be increased in nerve cells, or threefold increase. But are you fit to take it? In terms of, are you on any medications that would interact, or would it work for you? Well, you need to work with us for that. You need to find out what's wrong for you. I would never advise you to go and pick up lion's mane mushroom and start eating. But there is evidence it works in some patients where we think it's appropriate to use them. Similarly, for exercise, I know I've spoken about exercise and briefly touched on that BDNF, which is the factor in the brain, which we can increase by fasting and exercise, and also by eating fruits like apples, red cabbage, things like that. They help to improve what is called as cognition. So cognition, basically, I know I've been talking about brain health, and I'm talking about cognition suddenly now, 3/4 way through. It is basically your memory, your thought process, your senses, everything getting together, how you relate to the tasks you do, how you remember doing them, what your thoughts, what your feelings around them, that all, it's not isolated, that my thoughts are my cognition, or my memory, my learned experiences, my cognition. We get them all together, working together. That's what it is cognition. And we need you to live into the latter years of your life with better cognition, because I've seen firsthand. I take you back to a few years, I think about 5 years ago, I was working at a GP surgery, and we were responsible for a home for dementia patients. And I went in there, and that was, just, I don't know whether you've had a moment when you're standing in the middle of somewhere and you feel like, where am I? This is surreal. That was the moment. I just stood there. I was surrounded by patients, and then I heard a loud noise, a lady saying to her daughter, just get out of here. Yeah, I don't know who you are. And I just thought, where am I? Where is this world? This was the world of a nursing home with Alzheimer's dementia. What we want is, to take control of our lifestyle. We want to take control of the factors we've discussed about today, the metabolic health. We don't want to be standing there in the middle of a whirlwind where we see our loved ones being the shadow of their former self. I still have that etched in my mind, how I saw the daughter streaming tears when the mum couldn't recognize her, and the aggression. So obviously the mum wasn't aware of what she was doing or saying. That's how her brain was. As we've learned today about what happens in the brain, but we need to work towards it. And I hope you're not gone off to sleep with all of this and wide awake, but I need to talk to you a bit more about sleep, right? So it is, I would say, one of the most important factors. So if I want you to take away something that I want you to practice today, is to invest in your sleep hygiene, invest in your sleep, get those hours, of sleep. Why? Because we've got an internal body clock that maintains tells us when to sleep and to wake. And we, in this modern day and age, with the technology, are creating and have a total havoc with our body clock. We are taking our screens to bed. That light is just not, our brain is not switching off. And then the melatonin, the chemical, which helps in maintaining the sleep, is being disrupted by this stress chemical, which is released by the cortisol. So we're struggling. And then, we've all seen after a bad night's sleep, we're all craving for fatty things, quick fix. So it's, again, a cascade. The blood sugar goes up, and then we're damaging our brain cells, the short of it. Stress, we spoke about it, and studies have shown that work stress, so you need to be in a good work environment. I'm blessed to be in one of the best teams here, so hopefully no work stress there. It's related to dementia, so if you're stressed at work, change your job if you can. And also high rates of Alzheimer's dementia found in depression as well. So what can we do? You know, this pill for every ill, there's new medications coming every day. I'm not saying stop taking the medications, because we work as functional medicine practitioners with you, with the medication you've been prescribed, to see how we can make you less reliant on them. And I mean, to be honest, to this day, they haven't found a medication which can stop the total progression of dementia. But, you know, if we can stop us getting to that barrier, and we can stop, you know, if we've got there already, if our loved ones have got there already, for them to lead a life that is fulfilling, and so that they don't become a shadow of their former self, that's what we're here for. So we work together with you, we assess your priorities, guided by all the full functional testing and the detailed empathetic consultation we do with you. Now, very briefly about the Beresden protocol, that's something I'm trained in. It's called the RECODE protocol. And Dr. Beresden is based in the USA, and it's a scientific protocol that, you know, he's done lots of case studies. And in fact, he's produced what we in science we call as meta-analysis recently, which have shown that if people present to him before the dementia, so who would go to him before dementia? If you've got metabolic conditions, if you've got a family history, so they have seen that the chance of developing dementia later on is markedly decreased. And similarly, people with mild cognitive impairment, so mild faculties of where, you know, the day-to-day life is affected by dementia, they are being helped by that. And also about ketogenic diet, you know, people, my patients most often ask me about that, you know, how does the ketogenic diet work? Is it important to do it? So the brain basically simply, you know, when there's not enough sugar in the body, we're depriving the body, we're putting you on a ketogenic diet, depriving it of the normal sugar. The liver will burn your fat, convert it into ketones, and the brain is very good at using that. In fact, we use this as a treatment for epilepsy, so there is good into it. And in Alzheimer's, we see that the brain, you know, cells are damaged, nerve cells are damaged, so it can't take up the sugar, but surprisingly, it can take up the ketones. So we're firing up the brain again, right? So we damage all the glucose cells, insulin resistance and whatnot, and by the plaques, but we're firing it up again. So so basically, inflammation is also surprisingly reduced by the ketogenic diets. But, you know, one of the main things I find patients find it difficult is the adherence. So in my opinion, it works, and, you know, it's a part of the protocol I do with my patients, and it's interesting, but I wouldn't recommend again to do it on your own without medical guidance. So this is where we are in terms of approaching our, you know, body imbalances. Indra, I'd let you take over. I've done a lot of talking here now, and hopefully it's clearer why we talk about, you know, Alzheimer's dementia as taking roots in middle age or even sooner. Thank you. You're muted.
Thank you so much for your presentation, Alpa. If you just stop sharing your screen.
Yeah.
That was a wonderful presentation. Even for myself, I was like, oh, okay, this is interesting, going back to the basics again and actually seeing how, as a collaborative care team, we can look at the whole picture of you. We have actually come to the end of our webinar. It's already nearly 1 o'clock, but if anybody does have any questions, then do let us know. We're happy to stay on for a few more minutes. The recording of the webinar will be available to everybody that's signed up to this system. We actually are hosting also a discovery webinar, which happens every Tuesday at 5 o'clock, where you can come and ask more questions about how the practice works and what processes and protocols and programs that we have available at the practice. So do let us know. Let me just stop sharing. Stop recording.